started what we call public reporting. Turns out you can go to our government website, medicare.gov, or another way that is termed is hospitalcompare.gov. And what you can do is you can punch in our hospital's name. You can actually literally type in Brigham and Women's Hospital. And it will show you how we do on certain scores that we are required to report to the government. Now the example I've given you here is one of our, whether or not, how well patients rated our hospital, by hospital. You can see that 81% of the time, our hospital was rated a 9 or a 10 by its patients. The Massachusetts average is 69%, and the national average is 70%. So you can imagine we're very proud of this score. Patients who reported they would definitely recommend this hospital. You can see that 86% of the time our patients said they definitely recommend us, with the national average being 71%. So we're very proud of this, right? Go to the next page, next slide. And here's an example of our catheter-associated infection rates. You can see that lower numbers are better here. You can see that our catheter-associated infection rate is 1.6. And you can see for our state of Massachusetts, it's 1.71. And this is the ratio of how many infections you have compared to how many you should have. If you're in a good place, you should be at 1 or less than 1. So this is a place actually where we're not doing nearly as well as we ought to be. So, and this is readily available to all of our patients on the website. Now, I think it's wonderful to make data like this available, but I question how effective it is in terms of how useful it is for patients. Because imagine you're having a heart attack. Are you going to go log into the website and say, look, this is how well they do in a heart attack here, and pick your hospital? No, you're just going to call 911, the emergency number, and have them take you right. So I don't know how much it really helps patients. But nevertheless, if you look at the data in terms of our progress, if you look, so again, these are all measures that are available on the Hospital Compare site. We have composite scores for heart attack, heart failure, and pneumonia. And examples of the measures that we're scored on is, if somebody comes in with a heart attack, how often do they get their aspirin on time? Or how often are they discharged with a beta blocker? Or did they get their catheterization on time? If they came in with heart failure, did they get their ACE inhibitor prescribed to them? Or for pneumonia, did they get oxygenation and smoking cessation counseling? And look at the mean score of all the hospitals in the US in 2004, and look at it in 2008. You can see that these numbers have gone forward. So even though most of us don't believe that patients look at it, I think the hospitals, nobody wants to look bad. So you can see that everyone's gotten much better at it. So this regard, it has worked, I would argue. Next slide. And if you look at our process scores now, you can see the median in the US, aspirin at discharge for patients with AMI, the median score is 100%. People who get their PCI within 90 minutes of arrival, catheterization within 90 minutes of arrival, the median score is 97%. So you can see that on these process scores, because they were put on the web, the hospitals have really figured it out, which we argue is a good thing. Now the problem is, it's not necessarily true. So if you look at the bottom here, these are newer process and outcome measures that are now being publicly reported in the US. With regard to these, you can see we've got surgical site infection for colon surgery. How well do we explain medications to patients? And how well do patients get VTEs in the hospital? You can see these scores are not nearly as they're nowhere near 100% like the others. So I think what we've taken away from this is when you do public reporting of measures, it's the process measures hospitals get pretty good at, but some of these outcome measures are a lot harder for us to still move the needle.